Good evening, Albuquerque. Thank you for joining Mayor Keller's Coronavirus Update Telephone Town Hall. For those of you who are wondering if you are connected, you are. Right now, you are in what is called listen-only mode, which means that you can hear me, but I cannot hear you. In just a moment, I'll introduce Mayor Keller and other city leaders, and then we will open it up for questions. But first, let me go over a few housekeeping items. If you would like to ask a question, you can press *3 on your phone and you will be put into line to speak with one of our staff members. Again, to ask a question, press *3 on your phone and you will be put into line to speak with one of our staff members. They will hop on, take down your name and your question, and then you will return to the town hall. Then, if you hear your name, you will be live to the entire conference and can ask your question directly to Mayor Keller and city officials. We'll do our best to get to as many questions as possible, so please press *3 now if you'd like to ask a question. Again, please press *3 now if you'd like to ask a question. Along with Mayor Keller, we also have a number of city officials joining us today who can speak to some of the specific questions folks in Albuquerque have been asking. We have Ryan Mast, our Director of Environmental Health, Carol Pierce, our Director of Family and Community Services, Cynthia Jaramillo, our Director of Economic Development, Harold Medina, Deputy Chief at the Albuquerque Police Department, and David Chenet, our Civic Engagement Manager. Now, I would like to turn the conversation over to Mayor Keller for some initial remarks before we jump into questions. Mayor?
Hello, Albuquerque. This is Mayor Tim Keller, and I just want to welcome you this evening to the second edition of our telephone town halls. These are something we're going to try and do occasionally throughout this challenging time in our community with respect to the coronavirus, and we're varying them a little bit. So sometimes they'll be on the weekend, sometimes they'll be during the day. This one is our during the week evening session. So I want to touch on a number of areas very briefly, and then we'll really try and cut it short so we have room for your questions. So let me begin by just sharing that I know the past several weeks have been in many ways tough on all of us as we adjust to the new normal of what our lives look like in the Duke City. But know that our top priority is trying to keep you safe during this time and also trying to keep the safety net operating that our city is in many ways responsible for, or trying to help our partners in our healthcare system do that. So for us, I do believe that there's no doubt together we're going to get through this. This is unprecedented and challenging for Albuquerque and our state and all over the country, but actually we're starting to see some early indications that the actions we're taking might already be having some results in terms of that term flattening the curve that we've all heard. And so we've got to keep it up. There's a long road ahead of us, but it's a road that is weeks and a few months, and then eventually our lives will return a little bit, at least, hopefully this summer, to what we're used to. But also, this is something that we know may come back. So for long-term expectations, we don't know what's going to happen. No one really does. But we do know that in the fall when flu season hits, at least that time around, we're going to be more ready than ever. And that includes right here in the Duke City. So this week in New Mexico, unfortunately, we did lose 6 people to COVID-19. And I know my heart and everyone else at the city, our families, in our community, we're feeling for what those individuals have gone through. It's also a reminder that their lives are at stake, and this is why this is so important to stay home. So, as much as I know the individuals are going through grieving right now for what's happened, I also want us to remember, this is why we all need to follow these stay-home rules. Because by the end of this, unfortunately, we're all probably going to know someone who had corona. Hopefully there will not be that many deaths, but just statistically, we're probably all going to know someone who gets this. And so it just shows how important it is that we continue our social distancing. Now, there are folks on the front line, from first responders to healthcare workers to food workers and more, who are working during these times. This even includes our own city employees who are working, in many cases, 24/7 to try and provide critical services to the most vulnerable. And this includes meals for seniors, it includes our drivers, it includes folks taking care of the kids of our first responders, even everyone delivering free meals from our school system, even our trash truck drivers keeping our city clean. I want to thank all of them from the bottom of my heart, and they deserve all of our gratitude. I know it was trash day in our neighborhood, and our drivers were greeted with signs and cheering as they rolled by my 4- and 6-year-old. But it's great to see that symbol of the city still working. But I also want to thank everyone who's staying at home. You know, this is one of the most important things you can do right now. And I know for the First Lady, Liz and I, it brings up its own challenges, whether it's trying to also check in with elder parents or whether it's just the fact that kids are climbing all over us and we're trying to work and we're trying to come up with different ideas to keep them busy and engaged. It's a collective challenge that we're all going through, and there are a lot of new ideas and concepts available on the internet and through APS that are going to help with that. Now, let me also mention a little bit more about this city safety net in the last few weeks, what we've been working on. We are continuing to try and provide emergency child care for those who have no choice. We know that staying home in some cases is a luxury. It could be because of income status, or it could be because you're an essential worker. All of these reasons mean there are still a segment of our population that may also have children that require child care. So our community centers are offering limited emergency child care, and this week we're going to try and even open up from 3- to 6-year-olds again for our healthcare workers and our first responders. We're also trying to do what we can with respect to everything from emergency food boxes to rental assistance. That's why our 4 key health and service centers are open right now. They're the only major facilities open to the public, and that's because they are the stop of last resort. Call 311 first, but there is a physical place you can go to get help. That includes even referrals with respect to things like domestic violence and child abuse and so forth. So there are a number of services at those 4 locations, which all of this is on our website and available by calling 311. Now, let me also mention with respect to our economy, as I mentioned, we've put up a rental assistance fund that people can donate to. It's onealbuquerquefund.org, but that's, again, going to emergency rental assistance that's available through those 4 offices that I mentioned. We also are trying to do what we can for our micro businesses. This week we rolled out a micro business grant program. $500,000 of emergency funding in $5,000 increments that we're trying to give to the businesses most in need, just to try and prevent them from permanently having to close. So there's more details on that if folks have questions as well. And lastly, we are trying to keep up construction. So whether it's paving your roads or striping your roads, or doing some of the architectural work that can be done from home and the contract work that can be done from workers from home, the city is trying to continue to prop up our economy and hopefully be in a little bit better place when it comes to recovery. Lastly, let me, of course, thank all of our first responders and also let folks know, we are doing everything we can to support our police and fire at this time. And so far, Albuquerque has done a great job respecting 911, not calling it unless it's an emergency, and also working with filing police reports and so forth over the phone or on the internet. And lastly, parks and open space. So this is something as a city we want to make these public areas available for people's health and exercise and even in some ways psychological well-being. And we are requesting, though, that everyone maintain the appropriate rules. So stay 6 feet apart, wash your hands before and after. And again, those playgrounds are closed. But we do want folks to go out and use those facilities and then go back home. And that, of course, leaves more room for others. And a reminder, too, that we have lots and lots of open space. So if you go to one that might be particularly crowded with no parking, again, check out on the internet and so forth. We have all sorts of facilities that actually are still experiencing very light usage. But of course, some of the mainstays are getting heavily used, especially on the weekends. But if we can maintain these proper social distancing rules, we're going to be able to keep these open and keep enjoying them. So it's very important that we all do our best there. So with that, let me do a couple of things. Remind everyone, when in doubt, call 311 or go to cabq.gov. Also remind folks that the governor relaxed the testing standards. So now you are allowed to go get tested if you think you've been exposed to an individual who's tested positive, or if you're a family member, which is, of course, related, a family member who has corona, you can also get tested. And so that is a reflection of the hard work our state has done and our city and our hospitals to not have, we've worked through a big chunk of the backlog, so we're able to open up some additional testing criteria. So with that, as we did last week, we got a bunch of callers. I think last week we topped out at 18,000. So I'm going to cut it short to get to as many questions as we can. Alan, I'll hand it over back to you.
Thank you, Mayor. And thank you again to everyone who has joined our call this evening and for participating with us today. We have over 5,000 people on the line with us right now. And if you're just joining us, if you'd like to ask Mayor Keller and city officials a question, please press *3 on your phone. Again, to ask Mayor Keller a question, please press *3 on your phone, and you'll be connected with our staff to take your question. Now, Mayor, right off the bat here, we're seeing a lot of questions sort of along the same lines. Since our last town hall, we know that information has been changing. So right now, what's the most up-to-date way for folks in Albuquerque to stay safe right now?
The most up-to-date way is really just to remember the key mantra with respect to stay home, and this guidance that unless it's for exercise or it's for getting food or emergency services, really stay home. Now, if you're an essential worker, the updates, you should check in with the entity that you work for exactly how to be doing that. And the other piece is, if you want to kind of understand the latest, you can always use 311 to dial in. You can always check our website, cabq.gov, or just Google City of Albuquerque, and right across the top you'll see a great summary of all the corona updates. And then, of course, you can call the DOH. So for all your non-urgent medical health questions, including those about corona, especially those about corona, there's the DOH hotline there. And I'll tee up Ryan Mast as well if he wants to chime in on other ways folks can keep up to date with the latest.
Thank you, Mayor Keller. My name is Ryan Madson. I'm the Director of Environmental Health for the City of Albuquerque. We've been working really closely with the State Department of Health for several months now, and really ramping up those efforts on the coordination side, especially around testing, around potential surge capacity. And the mayor's exactly right. We have been really working to get additional modeling and data, and that takes time to garner that back and get the information back and be able to analyze that. And we're now starting to get through that testing backlog and have a better understanding of the spread in our community and what that's going to look like. And so, as the mayor mentioned, that's exactly why the state was able to sort of relax some of the testing protocols right now. But we still ask that you check in with your healthcare provider or call the Department of Health hotline if you before you go in for testing, just to check in with them. But some of the other things that we should be doing, in addition, we know that there's times that you need to go out to get essential supplies or get some exercise. Please do that in small groups. One of the things that we've been noticing, especially around the city, is that a lot of folks are going out in large groups to get their groceries and to go shopping, and all you're really doing is creating a new space where you're congregating. And so what we really want folks to do is to do that with a solo trip if you can, to check in with folks who are vulnerable, maybe elderly parents or your neighbors or somebody who may have serious illness, and do that trip for them, but do it in a limited capacity and get back. I know a lot of stores are offering curbside pickup now. We really appreciate our private sector partners who have gotten creative about helping us with the physical distancing, with cleaning down supplies, and cleaning down their areas to make sure that everybody's staying safe. The last thing I would mention is that there is ongoing blood drives. We've seen a lot of outpouring of support for that, but there is going to be a continuous need, especially as we prepare for a potential surge in the state. I myself went this week and gave blood, and they said they're booked up through next week, but beyond that, they have plenty of appointments. The greatest thing about that is you can just schedule an appointment and go in, and they can get you in and out pretty quickly. They do a tremendous job of keeping the location safe and sanitary, and so it's a great opportunity to do your part to help for this particular crisis. Thank you.
Thank you, Director. And if you're just joining us, please remember, press *3 on your phone to ask Mayor Keller and city officials your question. Again, *3 on your phone to ask Mayor Keller and city officials your question. For our first question, we're going to go to Jayla, who has a question about quarantine in Albuquerque. Jayla, go right ahead.
Hello, Mayor. I just have, a lot of states have been quarantined completely to where they're not able to leave their homes, and I just wanted to know if there was any chance that that could happen in Albuquerque.
Thanks so much for your question, Jayla. As we look around our country, I know that a lot of communities are in a high variety of different situations. And when we think of towns like New York right now and Seattle, they are having to do some very strict and heavy-handed quarantine-type measures. So with respect to where we're at in Albuquerque, I think there's a little bit of good news and sobering news. Right now, there are no plans to do that, and we don't see a need to do that. But all of that is dependent on a couple of things, and we don't necessarily know the answers right now as to how this will play out. So one thing is just the amount of community spread. So the Department of Health is looking at folks who get corona, and they kind of assess, are these folks who got it probably from traveling or from family members who are traveling, or did they get it from, just being out in the community? So that community spread number is very, very important. And when you get really high community spread, you have to increase the level of enforcement with respect to staying at home. So that's a little bit of the science behind it. Again, we don't see a need right now, but look, if it ends up where our town on a percentage basis is feeling and being affected the same as New York, we would absolutely have to do that. Now, the other aspect to this is how good we're doing right now at our own staying at home and social distancing. So the predictive factor is that as long as we're doing a good job doing this, we believe we don't have to do anything else. And so you can actually help prevent the need for that, if you will, by practicing all of these current stay-at-home rules and social distancing rules. So hopefully, if we keep doing a good job, and by and large, Bernalillo County has been. There's always exceptions, but there was a report that came out today that gave us a B in terms of a letter grade, and we'd love an A, but I'm pleased that so far the majority of folks are taking this very seriously and doing the best they can. So I'm optimistic that if we keep doing that, we won't have to get that much stricter. The last thing I'd mention, though, is that our city is blessed to be the economic capital of a big region in the high desert, about 1,000 square miles. We've got the most population, we've got the airports, the hospitals, the big shopping malls, and that does mean that down the road the impacts might be stronger here than the rest of the state, in which case we'd have to take a little stronger health measures. So we'll wait and see and hope for the best, but that's sort of how that would play out in the future.
Great, thank you, Mayor. And again, if you're just joining us, please press *3 on your phone to ask the mayor or city officials a question, *3 on your phone to ask a question, and our staff will be right with you. Now, Mayor, again, we're seeing a lot of questions about unemployment, and I wanted to take a moment to give out the website for folks who may have questions about unemployment for the State Department of Workforce Solutions. So if you do have questions about that, you can visit their website at www.dws.state.nm.us. Again, the New Mexico Department of Workforce Solutions, which is the place to go for unemployment information, www.dws.state.nm.us. And Mayor, along with that, we're seeing questions about rental assistance. Can you expand a little bit about how the city is able to help right now?
Sure, and appreciate you bringing up the unemployment procedures and how to access that. And just as a note, this is a state-run entity that obviously is experiencing literally the highest call volumes they've ever had. I think they mentioned now since the Depression. So that is just, letting folks know how overwhelmed they are. But it's my understanding the online portal in particular is still working well, even though there might be some challenges with sort of getting through over the phone. So just a tip to really emphasize going through to the online portal. At the city level, again, we're trying to help our micro businesses. These are folks much smaller, 5 people and under, with our direct grant program. This was designed to fill a gap that everyone else federally and state, they're providing loans, and that doesn't work for everyone. Some people literally just need a month to prevent things like their business being taken over or defaulting on their debts and so forth. So that's what that program is really about. And if there's any way we can scrounge up any other funding, or if there happens to be some foundations and so forth that can help contribute to that, we know that's been overprescribed. We have about 100 grants available, and we've already had 800 small businesses apply. So we're going to continue to try and fill that gap, but obviously that gap is really big. So we'll continue to work on that. I would mention that the city has put up a one-stop location for all things business support. So if you, again, go to cabq.gov and just type in economic development, or click on the Corona link and you can scroll down to the economic development toolkit. It's at least a comprehensive guide with all sorts of different ways to get different kinds of support right now. So that's a good first door to knock on, would be our City Economic Development website. And Cynthia, would you, our Director of Economic Development, do you want to add anything else to that?
Thank you, Mayor. Again, this is Cynthia Jaramillo, the Director of Economic Development, and I just want to echo Mayor's remarks. Since launching the Micro Business Relief Program for 100 grants for local businesses, we have received, and now, Mayor, we're up to 900 applications. Applications will close on Friday, but as Mayor mentioned, we are aggressively seeking other funding streams. And there are other funding resources that can be found on our website at cabq.gov/economic development. And also for those that are able on the phone, you can donate to the One Albuquerque Fund to support small businesses and other COVID-19 related efforts. Also want to let you know that if you cannot reach us via the website, or you'd rather speak to an actual person, you may reach us at 505-768-3730. We're happy to answer any questions regarding our micro business relief fund or any other programs at the federal or the state level. We also are available, we have Spanish speakers available to answer any questions for Spanish-speaking businesses.
Thank you, Director Jaramillo. A reminder for those of you that are just joining us, you can press *3 on your phone to ask a question of the mayor and the city officials. That is *3 on your phone, and our staff will help take your question. I also want to update everyone that we have over 12,000 people who have joined tonight's event. So thank you, everyone, for joining. The website that Director Jaramillo just discussed for the One Albuquerque Fund is also www.onealbuquerque.org, and that's spelled out ONEalbuquerque.org. Next, we're going to go to a question from Christina, and Christina has a question directly for the mayor. Go ahead, Christina, you're on the line.
Oh, hi. My first question is, are you taking care of yourself? Because it seems like you are everywhere all the time. Thank you. And then I just had a second comment, which was thank you for supporting the Red Ball Cafe so much. We appreciate it here in Barela.
Oh, Christina, thank you so much for that. And great to hear from you. And I hope Red Ball's hanging in there. We have so many good restaurants all over town. I know some are open, some are not. And Ironically, I got takeout all the time before Corona happened anyway, so I'm a takeout pro. And so I got to continue my rotation, but want to encourage everyone when they can to also use takeout to try and keep our restaurants afloat. And a good plug there for Red Ball. Thanks for your thoughtful question, too. I really appreciate it. And I would just say so far, my family's healthy. We're doing great. And for me, I'm fortunate to have a really good team, really good staff here, both throughout the city, that enables us to keep up the communication that we're doing and also work remotely and so forth. And so just really appreciate the team helping me also be able to stay healthy and do things like this. So we'll keep trying to do everything we can for the community. And I do know that a lot of us will have friends and family and coworkers that might get this. So also important, when that happens, just to support them, whether it's checking in via the phone or video or bringing them food and so forth. Those are great ways to help those of us who, might not be feeling as good. And so right now I'll continue to do that and hope that I can just continue to support the community. So thank you so much.
Great. Thank you, Mayor. Again, *3 to ask a question for the mayor and city officials, and our staff will be with you to answer, to take down that question. Again, *3 on your phone to ask a question. Next, we're going to go to Sonia, and Sonia has a question about outreach for those experiencing homelessness. Sonia, you're live on the line.
Thank you. What outreach is there for the homeless regarding food, testing, and temporary housing, especially those persons who don't go to places like Noonday the Rock or St. Martin's? Can empty apartment complexes be used as they are in some other cities? And the second question is simpler. Is rapid testing available here yet?
Thank you, Sonia, for those two questions. Let me tee up two of our experts to dive into those. First, on homelessness, our director, Kayla Pierce, is on the line, and she can walk through. I think, fortunately, our city has been sort of ahead of the curve, so to speak, on this, and we're working on a number of fronts with the different types within this population. But Carol, our director of Family and Community Services, can speak to that. And then Ryan Mast, our director of Environmental Health, can probably touch on your rapid testing question. Carol, why don't you go ahead?
Thank you so much, Mayor. Yes, I'm Carol Pierce, the Director of Family and Community Services. I really appreciate the question about those experiencing homelessness. We've been working daily with all of our providers that do provide services for those who are homeless, and that does include outreach. So we have a coordinated outreach that involves many of our partners, including Heading Home, Albuquerque Healthcare for the Homeless, First Nations, and many others that come together twice a week to strategize and make sure that we're reaching folks that are out there in our community. Another outreach mechanism is street medicine, which we're very fortunate to have, which is through Albuquerque Healthcare for the Homeless. So those outreach mechanisms are occurring. Our West Side Emergency Housing Shelter, for those folks that will go there, which we highly encourage, we are open 24/7. We are providing food. We appreciate the food donations that the community has given us as well. We are a COVID testing site, and we have structured our shelter so we have an isolation area. I'd like to say, knock on wood, so far so good. I mean, we are a little ahead of this. We've been really out there educating people who are experiencing homelessness. We've got a great handout developed by Albuquerque Healthcare for the Homeless. And so while we've had people tested for COVID, we haven't had any positives yet. So we're working with folks. We're also working to make sure if a motel voucher is what really keeps somebody safe and off the street, we have a mechanism for that as well. So we're really grateful for the partnership we have in the community to address our vulnerable population, people without homes.
Thanks so much, Carol. And I do want to mention two other aspects to this just briefly. We are taking donations for hotel vouchers, and I know the Albuquerque Fund actually already wrote us a $50,000 check for this. So the overflow, or for folks not tied into the individuals or the different facilities like Noonday that you mentioned and so forth, we are able, if they're not even if they have corona, but if they're just sick or they have different conditions, we're temporarily trying to put them up in hotels. And right now we think there's enough capacity and funding to be able to do that. But I want to let you know also that our city is fortunate to have a very robust emergency operations center that is looking at, much larger scale situations. For example, if we have to use our community centers, all across town, we have dozens for different types of populations, including homeless. So we are in the process of preparing for that. Right now, again, we don't have to do that, but I think we do in our town. We're lucky to be able to scale pretty good in this area. So to your second question, a little bit on that from Director Ryan Mast.
Yeah, thank you, Mayor. Again, this is Ryan Mast, Director of Environmental Health. I think it's a really excellent question. Of course, there's a lot of testing, different types of tests that have been coming through, and the federal government through the FDA have been trying to fast track these a lot. One of the key things for us was to get through the backlog. One of the good things, or at least the good situations for New Mexico, as opposed to, or in comparison to some of our other states, is that we have had a lot of testing that has been done, but we had to get caught up, and so we have now done that here in the state. And so the testing that is available now is able to get done in a much quicker pace. Some of the rapid tests that they've been trying to get through approvals, we do anticipate coming soon. That includes several different types of tests, including what they call an antibody test. So that just determines whether, for folks who may have had the virus in the past but have now sort of recovered from that can sort of detect that aspect. So we're advocating really hard. I'm on the phone with private sector partners as well as the Department of Health every single day, trying to make sure that New Mexico is getting every possible resource that they can, whether that be from the federal government or from the private sector, to get enough supplies and testing kits for us to meet our needs. So we do anticipate more rapid tests coming to help maintain the need that we're going to see here in the coming weeks.
Thank you very much, Director Mast. And again, if you're just joining us, please press *3 on your phone to ask a question. *3 on your phone to ask a question, and our staff will be right with you to take that information down. Next up, we're going to go to a question from Valerie. And Valerie has a question about seniors in high school. Valerie, go right ahead. You're live on the line.
Hi, Tim. Thank you for taking my question. Actually, I have a couple of seniors in my household who are pretty anxious about not being able to graduate this year and walk the line. They're pretty academically inclined and things like that, and it's causing them a lot of anxiety. And I was just wondering, because there hasn't been a lot of communication in regards to what they're going to be doing with them, is there any direction at this point, anything that I can do to actually help console them? What are your plans in that regard?
Valerie, thank you for that question. And I know I've got some seniors as well, and their nieces and nephews, and it's just so heartbreaking at their stage in life to have one of the most important things in their life just completely pulled out from under them. And so it's very tough on seniors, both college and high school right now. And also as an APS parent, I know that there has not been a lot of details laid out on this. So here's, I think, the guidance I can give you. Number one is that I do know what they're looking at is they're trying to understand how long the stay-home order is going to be in place. And that will help determine whether or not they can have different types of gatherings or commencements and so forth. So I do know there's a little bit of time on the calendar for them just waiting to see. So I would say that let's give them a couple of weeks just to see what they cook up, because around mid-April, I think we're going to have a very clear picture of how long we might be in this. And again, it could be for several months, or it could be shorter than that. So I think the picture is going to get a lot clearer in the upcoming weeks, and I think therefore then APS will be able to make a lot more clear decisions, especially with things like graduation. The only thing I would mention that I know some folks are doing and we're trying to do is, as much as you can set a date to celebrate, perhaps the end of July or something like that with family and friends, both high school friends, but also, kind of those traditional family gatherings and so forth. I know for my family and others, we're trying to set like an artificial graduation date at the end of July when hopefully we'll be able to all celebrate together. And yeah, it's not nearly the same, but at least it's something to look forward to. And I think that little bit of hope and even organizing it can be a helpful activity right now.
Great. Thank you, Mayor. Again, to ask Mayor Keller a question, please press *3 on your phone, and our staff will be right with you. Again, *3 to ask a question, and we do have over 13,000 people who have joined tonight's event. Our next question comes from James, and James has a question about how we can help folks that need it. James, are you there? You're live.
Yes, I'm here. Hello, Mayor. I just wanted to ask a question if you guys had any city-funded food drives planned, and if so, if you had reached out to large food distributors like Cisco to help you guys put that together.
Thanks, James. Good to hear some little ones in the background, too, I think. So let me tee up David Chenet, who runs our community engagement, to chime in a little bit on this. But overall, we are partnering with basically every organization that we can find to work on food boxes for seniors and meal deliveries for seniors, as well as feeding our homeless folks. And so those are all being coordinated. And right now it's been great because we've been rolling through, whether it's large organizations or whether it's partnering with Roadrunner Food Bank or it's even faith-based community organizations, we've been actually able to kind of work together on that. So from an organizational perspective, that is happening, but also individuals can help kind of contribute, and we've set up a way to do this, and that's what David can speak to. And so, David, why don't you tell us a little bit about the Civic Engagement Portal?
Thank you, Mayor. This is David Chenet, Civic Engagement Manager. So the City of Albuquerque is coordinating volunteers through a new virtual online platform, One ABQ Volunteers. That's one spelled out, abqvolunteers.com. Community members can use the One Albuquerque Volunteers website to find safe volunteer opportunities and donation drives. Additionally, non-city entities can also post their own volunteer opportunities and donation drives on the site as well. So if you're a nonprofit, faith-based organization, or a local business looking for volunteers, you can post opportunities on our site. Everyone is welcome. Once you pull up our site, you'll see a large red banner that will lead you directly to opportunities dedicated to COVID-19 support and relief. Right now, the city has a few pressing volunteer needs that I can share. Volunteers are needed to assist with screening employees at the Albuquerque Emergency Operations Center. Roadrunner Food Bank is looking for warehouse volunteers to help with food prep and distribution. And Meals on Wheels is looking for volunteer drivers to help feed local residents. Mass New Mexico 2020 is recruiting volunteers with sewing skills and seeking donations to help make sure local health providers don't run out of protective masks. Albuquerque Mutual Aid Volunteers is a coordinated neighborhood-level response to help keep your neighbors and friends safe as they shelter in place. You can also find cash and charitable donation drives that support some of Albuquerque's most vulnerable populations on our site. I'd also like to add that the only way for the city to capture the impact of volunteer efforts is to track volunteer hours. You can easily record and track your volunteer hours on our site. This is especially important because FEMA can reimburse the city through a public assistance grant per volunteer hour for the good work that is already being done. This money can help our city recover from the pandemic, but only if we log hours. So I encourage you to find these opportunities and many more and record your hours at oneabqvolunteers.com. That's one spelled out, abqvolunteers.com. Thank you for your question, James.
Thank you very much, David. Again, a reminder, *3 To ask Mayor Keller and city officials a question, *3 on your phone to ask a question. Our next question comes from Bernice, and Bernice has a question about the Albuquerque Police Department. Bernice, go right ahead. You are live on the line.
Hi, Mayor, and thank you for all your work. My question is it true that APD has roadblocks set up at night? And is this to help with the stay-at-home or look for warrant out or whatever? Is it true?
Thanks, Bernice. Thanks for that question. The short answer is no, not true. And I'm glad you asked, though, because there are a lot of myths floating around now about kind of what APD is doing and where our crime situation's at. And actually, I think we're lucky tonight if our DC Deputy Chief Medina is on the line. He's the chief in charge of all of our field patrols, so any officers who would be doing those type of things. So DC Medina, if you might give us an update and add any additional clarification for Bernice.
Thank you, Mayor Keller. Bernice, thank you for the question. This is Deputy Chief Medina with the Albuquerque Police Department, and just wanted to update the community kind of where we're at as a police department. First of all, there are a lot of myths that we're stopping people or we're conducting roadblocks to enforce the stay-at-home order, which is completely false. We do courtesy checks for the New Mexico State Police at their request, where we ask individuals, especially businesses, just to make sure they're closed. Or if we see large groups, our officers will ask the individuals just to disperse, all courtesy, nothing that we're enforcing at this time. And crime-wise, we have some crimes that we're seeing indication that there's an increase, such as commercial burglary, which could be expected with so many businesses being closed. But we are redirecting resources back to those problems and making sure that we're addressing those problems. But there was a lot of individuals who felt that we could see an increase in domestic violence or calls for service. We just haven't seen those increases. Unfortunately, there still are people out in the community committing crime. And as they commit those crimes, we still need to dispatch our officers. And our officers are still arresting individuals and taking them to jail and interacting with the community. A couple key points to remember is we do everything we can to keep the community and our officers safe. So on the front end, we made sure that we reduce the number of calls for service by utilizing online and telephone reporting methods. And we're asking the community to please continue to use telephone reporting as a method or online. If you call 242-COPS-2677, once again, that's 242-2677. If you call that phone number, they could direct your phone call straight to the telephone reporting unit and get your report taken over the telephone. We've also protected our officers through issuing them the gear that they need to go out and make these contacts with the community and be safe. And then the last thing we're doing is we are fortunate that we haven't had an officer test positive, but we're sure that somebody is going to test positive at some point, and making sure that we have a plan in place for the officer and their families to ensure that they have the peace of mind and safety that they had a responsible administration watching out for them. So the officers are still out there. They're doing the best they can to enforce all the laws. They're using discretion when they have to, and if something low level, people may get a warning, but we're still out there and we continue to be out there, and we know that we have to be out there throughout this whole process to keep the community safe and also to make the public feel safe. Thank you.
Thank you very much, Deputy Chief Medina. Again, to ask a question, press *3 on your phone. *3 on your phone to ask a question. Our next question comes from John, and John has a question about buses and our transit system. John, go right ahead. You're live on the line.
Hi, Mayor. I've been riding the bus for 50 years already, so that's a long time. And I noticed that you cut it back to Saturday schedule. And I'm still able to get around wherever I need to go to and from, and grocery stores and banks and stuff like that on a Saturday schedule. But God forbid if we got to really cut it down or eliminate it, could you at least give the passengers at least a 2-3 day notice that you're going to shut it down if you have to? I hope you don't. But if you do, could you at least, give us a 2-3 day notice to, stock up on some groceries, do our bank business and stuff like that?
Thank you, John, for that call, and just really appreciate your dedication to public transit. And I'm extremely glad to hear also that the Saturday service still works for you. That's great news. I've had to make a lot of they're informed judgment calls during these times, and you hope you make them all correctly. And this was one that was really tough because a lot of folks were concerned about driver health and why are all the buses running, and then there's another group that we're also trying to make sure and support who need the bus and use it to do groceries and banking and even healthcare, especially our hospitals are going to their doctor. So I really appreciate you mentioning how important this system is. So it is covered as a essential service. And so right now we're okay to continue running with that reduced schedule. And wonderfully, actually, our actual bus drivers and the union that represents them and stuff, we've worked with them, and we really like the Saturday schedule because it allows flexibility on their end for a flexible work schedule, but those who do want to work can do it. And so my intention is to keep this Saturday service going, unless we actually absolutely have to shut it down, really because it's essential infrastructure for our community. Part of that safety net we've got to keep going. So that's the plan. And of course, your point about notice is very good. I think we can probably deliver on that, meaning that even last time around we gave, I think, a 3-day notice before we scaled back. And so I think we can make sure and do that if we do have to even make some more changes. And of course, I'm sure you know this, but for others, if you want a route info update, just go to cabq.gov/transit, or the ABQ Ride app works very well, or you can call 311. A fun fact is that the number one type of call that comes into 311 is, when is the bus coming? So that still works too. Thanks, John.
Thank you, Mayor. Again, *3 to ask a question, and our staff will be with you to take that information down. *3 to ask your question. Before we jump into our next question, we're going to ask all of you to participate in a short poll that we're going to do here, a question about how you're getting information regarding the coronavirus right now. So you're going to use the keypad on your phone and press one of these answers. So press the number 1 on your phone if you're getting information from cable news stations like CNN, MSNBC, or Fox News. That's the number 1 for cable news like CNN, MSNBC, or Fox News. Press the number 2 on your phone if you're getting your information from local TV stations like KOB Channel 4, KRQE Channel 13, KOAT Channel 7, or Spanish language stations. Again, that's number 2 for the local Spanish language stations, or Channel 7, Channel 4, 13, our local broadcast stations. You could press the number 3 on your phone if you're getting your information from social media like Facebook, Twitter, and Instagram. Again, the number 3 on your phone if you're getting information from social media like Facebook, Twitter, and Instagram. The number 4 on your phone if you are getting information from newspapers like the Albuquerque Journal or the Santa Fe New Mexican or some of our other local papers. Again, that's the number 4 on your phone if you're getting your information from the Albuquerque Journal or some of our other local papers. Please press the number 5 on your phone if you're using official websites like cabq.gov, the CDC, Centers for Disease Control, or the State Department of Health website. Again, the number 5 on your phone if you are using official websites like the State Department of Health, cabq.gov, or the CDC. And please press the number 6 on your phone if you are getting your information from somewhere else. Again, the number 6 on your phone, and we'll repeat this one more time during the town hall today. Our next question comes from Azul. And Azul has a question about different languages and information about coronavirus. Azul, please go right ahead. You're on the line.
Hello. First and foremost, thank you for what you're doing. And my question is more on a united front and, being respectful and admiring the beauty of New Mexico, and that, of course, is multiculturalism. What are we doing to reach out to our Native communities and to our Spanish-speaking communities to send these messages out? one of the problems that we've had is I know I think it was PED that announced that people are going that schooling is going into PBS, but we know that our Spanish speaking communities are kind of like, okay, what does that mean? What do we do? And they're kind of stuck. And so I wanted to ask, and I know we just had this poll right now, but what are we doing to relay all this information, even like a town hall like this, to our Spanish-speaking communities and our native-speaking communities? We know what's happening in Teneland right now, in Navajo country. What are we doing as a state to reach out and to send these messages in all languages?
Thank you, Azul, for that question. And I heard also about with this PED announcement, and actually my family's at one of the bilingual schools, and there were a lot of parents talking about this challenge as well. So let me speak, I think, first to the city. And unfortunately, right, I can give that feedback to the state and APS. And I think though the city is we're trying to do a lot more with this. So number one, it sounds basic, but on our website, we actually have now it translated. All the corona information is available in Spanish, Vietnamese, and Chinese and Dene. Now I know there's even more languages that are not up there, but all our COVID facts and so forth are available in that language on our website. So that's one thing we're trying to do. Second thing is we are trying to do Spanish language social media posts. So we have a Spanish language alcalde Twitter account. And we also have now, those of you who don't know, there's at 11:30, I do a daily briefing on social media and with traditional media. And at that daily briefing now, we have one Spanish speaker to do the whole thing with Telemundo and Univision. They don't always come, but when they do, we do it all over again for them in Spanish. So those are some of the things that we're trying to do. I know there's a lot more we could do. But lastly, we do have an Office of Equity and Inclusion that includes a language translation service. So all of our officers, all of our first responders now have, and same with all of our healthcare workers now, they have a line they can call that provides translation for about 29 languages. So we're making some progress, so much more to do, but those are some ways, at least I think, where we're trying to get the city messages out. And again, really appreciate Telemundo and Univision on that. I'd like to do a lot more on radio, especially. So that's an area we're going to be working on in the future. So I appreciate that, and we'll keep trying. But in the meantime, direct folks towards those two main TV stations or the Spanish Alcalde Twitter account is a great place, and then our city's website, which now is available in all of those languages.
Thank you very much, Mayor. Again, we are coming up on the end of our town hall in about 10 minutes here, so we're going to try and get to as many questions as possible. Our next question comes from Garrett, and Garrett has a question about what to do if you think you have the virus. Garrett, go right ahead. You're live on the line.
Hi, I'd like to know if I have the virus, should I go to the emergency room? Should I go to the urgent care? Or should I go somewhere for testing, and if so, where? And I'd also like to compliment both you and the governor, because I saw on the news today that we're either first or second in the whole nation as a state in testing for the virus. So thank you.
Garrett, thanks for that question, and also your directness too with just the situation, and appreciate you recognizing too. So far New Mexico is in a little better spot, and so we're grateful for that. So for your question, the first thing you should do is call the 1-800 number, and it sounds oversimplified, but it really is the first thing you should do. And it's actually I'm going to read you the number, and I'll say it slowly just so everyone can get it. It's actually 1-855-600-3453, and that is our State Department of Health. What they will do is walk you through a series of questions pretty quickly, and then they will tell you specifically where to go and what to do. So I just want to emphasize that that's a situation where you want to talk to an expert right away. That's the number to do it. If you want to read about the criteria and what to do, you could also go to nmhealth.org. And again, that's our State Department of Health. And right now, if you are, it's 9 to 5 during the week, you can just hop in your car if you think you're showing all these symptoms and go to the Balloon Fiesta Park, and there will be some professionals there who can at least talk to you through the car door. Again, I would only do that if you really feel that it's an emergency or you've already called those numbers. But that would be what I would say to do in short order.
Great. Thank you, Mayor. We will have time for one more question, but if we didn't get to your question, there will be an opportunity to leave a voicemail at the end of the town hall. Everyone will have that chance when the town hall ends. Do want to read that survey question one more time. Where are you getting your news about coronavirus? How are you staying up to date? Press the number 1 for cable news like Fox News, CNN, or MSNBC. The number 2 for local TV news like our broadcast stations or our Spanish language stations. The number 3 on your phone for social media like Facebook, Twitter, and Instagram. The number 4 on your phone for newspapers like the Albuquerque Journal or our other local papers. The number 5 on your phone from official websites like our cabq.gov website, the State Department of Health, or the CDC, and the number 6 on your phone if it's another place. Mayor, this is the last question we'll be able to take just due to time, but we're going to go to Janessa. And Janessa has a question about the mental health effects of this coronavirus crisis. Janessa, go right ahead.
Good evening, Mayor. Thank you for taking my question. So as a career firefighter with Bernalillo County, we take our mental health very seriously, especially in regards to the adverse effects of PTSD from our first responder work. So my question to you is, what interventions do you have planned to combat potential mental health issues that may arise from individuals who may not be handling the social distancing practices all too well? Has there been any thoughts as to handle this once this pandemic subsides? And kind of like one more question is not only that, but any thoughts on mental health interventions for our hospital workers who are kind of right there in the thick of it all?
Janessa, thank you so much for that question, and also for your service to our community as a firefighter for Bernalillo, and just really thank you for all that you're doing. And you have mentioned this aspect, of course, around mental health, and I know loosely what you're referring to with in terms of what our department goes through and the services that are available and how very, very important they are. So just want to emphasize the expertise from which you're asking the question. So here's what we're trying to work on. We are very concerned about this. And one, we want to remind folks that whether it's domestic violence or it's mental health challenges or even child abuse, these are all real issues right now that, as the chief mentioned, so far, knock on wood, have not really risen much, but we're very concerned about it as this continues over time. So I'll talk about mental health in a minute, but just on those issues, there actually are, as you know, a number of effective hotlines for just civilians to reach out to. And these are things that have been in place for quite some time, but they have shown that if you call, they really help. And so they're all available on the CABQ website if you look under the Community Resources section. But I'm not going to read all the numbers right now, but there are easy access numbers for UNM Mental Health. That's 272-2800. There's also a range of child abuse, elder abuse, and rape crisis center. They're all on there. You can all also just Google them on your phone. But again, want to folks encourage you've got to reach out if you or someone else knows something and is worried about something to one of these particular numbers. I also want to mention just the New Mexico Crisis Hotline. That's 1-855-662-7474. So for us, what we are going to try and do is, as we go through this, we're also going to try and utilize our 4 public health and service centers that, again, they're a place of last resort right now that are still open for our community. There's 4 in each quadrant of the city. You can find out where they are by calling 311. But these are places to go if you don't know where to go. Show up there, especially if you feel like you're dealing with any of the mental health challenges, even with respect to suicide and so forth. If you need to talk to someone immediately, again, those hotlines are the best. But if you also need to see someone face-to-face, that's why we're keeping those 4 centers open. And as we go through this, we want to really continue to be flexible with those centers and essentially make those the home for mental health and emergency services as we go through this. So also, lastly, I want to mention folks can help with respect to first responders in general by donating to the Chaplains Coroners Fund. They can also call if they want to just help out in this area. So if people want to volunteer with respect to areas around mental health for our first responders and healthcare workers, they can call 768-2131. And lastly, you asked just a very thoughtful question. Our city is right now in the process of planning. We don't have a very good term for this yet, but we're calling them respite centers. These are going to be a third space for our healthcare workers and our first responders who don't feel either psychologically or health-wise that they can go home, and they also can't go to work or they need to get sleep. So we are putting together a plan to utilize our community centers to provide this. And I'm hoping within the next 10 days or so, we'll actually be ready to do that should we need it. So know that we are planning on how to provide that third space for hundreds of folks first responding and providing healthcare in our community. It's a great way that the city emergency operations, which is a joint city and county project, can work on that. So that is actually something I'm reviewing tomorrow morning with them. Okay, thanks for that question. And I know we're unfortunately out of time. So want to remind folks a couple of things. One, easy to get information from 311 or on the city website. 2, tune in at 11:30 on any social media platform to hear our daily briefings, which do include tips on how to deal with what we're doing staying home, myth debunking, and all sorts of good information. It's the most action-packed 30 minutes you can find right now as we're all staying at home. So you can always tune into that each day. And lastly, let me just say that I really appreciate the way that members of our community continue to step up for one another. And I want to thank all those who are staying home to try and prevent spread. And I want to thank you also to those who cannot stay home. First responders like our last caller, our healthcare providers, service providers, bus drivers, folks driving our trucks and our grocers and our farmers, and so many more. Thank you so much. I know we're going to get through this as one Albuquerque, and we're going to be better off for it in the long run, even stronger and resilient than we are now. So with that, thank you so much. We'll look forward to talking to you again, and I'll turn it back over to Alan.
Thank you very much, Mayor, and to all of our City of Albuquerque officials who joined us today to provide key information for everyone. I'd like to remind you that if you weren't able to get your question answered or leave your comment, please remain on the phone, and at the end of the call, you can leave a voicemail. Please leave your name, address, email address if you have one, and your message. Thank you again to everyone for participating in today's Town Hall event. Please visit www.cabq.gov for the latest information or call 311. If you'd like to leave a message for the mayor or we didn't get to your question, please remain on the line and you can leave a voicemail in just a moment. This concludes the Telephone Town Hall. Thank you and good evening.